Welcome to the Brendan G Podcast. We're going to be exploring mental health and the connection to gut health. And on board here, we've got an expert in the field, Amanda Emerson. She's a licensed clinical social worker with over 2 decades of experience in the mental health field. And she's enrolled in a PhD program in the International Institute of Clinical Sexology over at Miami, Florida. And she runs a mental health clinic over in Little Rock. Amanda, welcome to the show.
Thank you for having me. I'm thrilled to be here and to talk about this topic with you all because it is very, very close to my heart. And it's everything that I talk about and do within my practice.
Fantastic. Yeah, and we're going to be hitting all kinds of topics here. We're going to be talking about the brain gut connection, how hormones are involved, ketogenic diets. We're going to be following some of that stuff and how that impacts mental health. And we're going to be talking about some common solutions as well. But give us a little bit of background on what you're doing, what you're involved in, and then we can jump into the brain gut connection.
Absolutely. So I have my own private practice in North Little Rock, Arkansas, where I practice all different kinds of modalities for therapy, but I work specifically with complex
Mhm.
trauma in a lot of different cases and in a lot of different ways. I also have I do coaching as well out of the clinic, so that way I can provide services globally via telehealth and things like that to talk about these things and help. So I do hypnotherapy. I'm a certified sex therapist, and physical and mental health is just my passion. I really want to get people connected and talking about it because it's extremely important. It affects all areas of mental
Beautiful,
health.
beautiful. Yeah, and as you said before, you're not locked into a particular region because you do this over the phone as well. You do Zoom calls, I would assume, and whatever, right?
Absolutely.
That's perfect.
Yes, yes, because with like things like hypnotherapy, it's all about overriding some of our subconscious beliefs to heal faster.
So, obviously, we talk a lot about gut health. We think it's a cornerstone of overall health. You see this from a slightly different perspective. I think it's very interesting, this mental health component. Could you explain your understanding of this connection between gut health and mental health?
Yeah, so research has shown that an unhealthy gut can contribute to a range of mental health issues such as anxiety, depression, and even cognitive disorders. Inflammation in the gut can affect brain function, and imbalances in gut bacteria can influence our neurotransmitters and the production of certain hormones such as serotonin, dopamine, cortisol, and that affects our moods and our overall emotional well
Yeah,
being.
we talk about serotonin and cortisol quite a bit. Maybe we should focus on one of those first and kind of do a deep dive. Should we start off with cortisol and
Yeah, yeah, so cortisol, is a stress
Mhm.
hormone, and it breaks down in the body as sugar. And the increase of that really affects your gut health, the breakdown of the digestive system and the foods that you're eating. But it also actually increases
Yeah,
anxiety. So a lot of times people will experience essentially their own sugar crashes throughout the
right,
day, and that's going to have a huge impact on their
right,
moods.
right. Yeah, and if they have an inflamed gut, right, they're going to have cortisol up just even if they're not necessarily experiencing stress. That's like almost a side effect. But that the increase in cortisol is going to end up jumping the blood sugar, right? Is that? And that's basically what you're talking about,
Mm-hmm.
yeah?
Yeah, so it says when stress is ongoing, the body will continue to produce high amounts of stress chemicals. In contrast, though, unresolved things like
Mm.
complex trauma actually associated with chronically low levels of cortisol within the bloodstream. And so what happens is this is where a lot of autoimmune disorders and things
Yeah.
like that come from, like fibromyalgia and diseases, because you're essentially putting your foot on the brake and on the gas at the same time of your
Oh,
nervous
that's interesting.
system,
I never put that together
and there's
before.
no
Okay.
and there's no with the parasympathetic nervous system, that's all about rest, digest. But if you're having a lot of complex trauma and flashbacks and emotions all over the place, you're in survival mode a lot. You're not allowing your body to rest and digest. And so that's where a lot of the buildup of these toxins in the gut and the inflammation can come
Right.
from. And with that, then it puts your body in basically an unchecked autoimmune
Yep.
response, and it starts attacking
Right.
itself.
Right. Yeah, we talk about it through a cascade of molecular mimicry, where typical pathogens will cross the blood-brain, excuse me, the gut barrier, and then it'll get confused with
Mhm.
components within the body. But you're seeing this from a completely different perspective, which absolutely complicates things tremendously.
Absolutely. And so, kind of what you're talking about is like you can develop leaky gut syndrome, and that occurs, when the intestinal lining becomes excessively permeable, like you're saying, allowing toxins, pathogens,
Yeah,
undigested food
yeah, it's huge. Yep.
particles to pass through the bloodstream, which can then trigger the systematic
Yeah.
inflammation.
Yeah, yeah, and food sensitivities,
And then
right?
that's
Like the body's not meant to see these things.
absolutely.
And then it sees these things and the immune system just goes crazy. Yep, that makes sense.
Absolutely. And when you're stressed and you're tired, picking up a coffee or something on the run seems like a really good idea. And it's sometimes all people
Yeah,
can do. They're working two different jobs and just trying to get by. And, we have to eat. And so they're eating as much as they can. But then all of that gets stored in their guts and they can't digest it
yeah,
properly, and a lot of times, talking about hormones too, if your body doesn't make the correct amount of, say, estrogen or
right.
testosterone or
Yeah.
progesterone,
Key sex hormones,
it's
right?
going to keep all of
Yeah,
yeah, it's going to keep all of this in the gut as well. And this is why a lot of people experience different body types where their stomachs are
yeah,
inflamed, right? And but their legs and stuff and their arms are really fit and tone, and they can't figure out how to just get that little bit that's left to go away. And it's because all of this stuff is stored there. Our bodies also store
yes.
emotions. Okay, so feelings is trapped in the body, and it's not allowing that to uh, move and
Yeah,
pass
in
through.
Chinese medicine, they say the liver is the emotional organ. Oftentimes, the organ of anger,
Yes.
more than anything else, but it is the emotional
Yeah.
organ. So, can you give us an example of how, like the imbalance of sex hormones, we're talking about estrogen and testosterone, might impact some of the things that you had just discussed? Because I think that's real interesting. People will probably want to know more about that.
Well, it impacts and has been shown to impact anxiety and
Mm,
depression levels, sexual health
no,
and well-being,
no
a lot of
doubt.
times
Yep.
libidos, right, involved in this as well. Um, uh, Basically, it causes that toxic stress
Yep.
response, um, and it throws you off balance with your moods.
Yes. Yeah. No. Definitely. And I've noticed. I can't remember. I've come across a couple of studies that show that some of these imbalances in male and female sex hormones end up sort of directing where certain fat cells are stored within the body, just like what you were talking about, to basically drive, the way certain individuals look, right? So if some people are,
Mhm.
they
And
keep weight on in one area, maybe it's the belly or the thighs, or in other areas, a lot of that is sex hormone driven. It's true, it's your genetics, but there's another level to this, which I think is interesting.
Well, and like you were mentioning the liver, right? And the gut, that's where serotonin is actually made and created.
Yes,
It's not from the brain, as most people
yes,
suspect. So, serotonin is essential for mood regulation, and about 90% of it is actually produced
yep,
in the gut. So, a healthy gut microbiome is crucial for that production, and your serotonin is what's associated with depression and
Right. That's
anxiety.
commonly referred to as the happy hormone, right? Yeah.
Yes, yes,
Yeah.
absolutely. So the combination of that, along with potential lacks of
Yep.
dopamine, is what's affecting your mood
Okay. So
swings. It's very
so let's
detrimental.
unwind this a little bit. So we have damage down the digestive tract, and we know that it's our neurons, and also there's components within the immune system that secrete serotonin. Those end up getting damaged, so we get decreased serotonin production. How is that going to get communicated back up to the brain? Like, how does that whole system work?
Well, it's just kind of like when you have, let's say, a
Mm-hmm.
blockage, right? Then only little bits of that serotonin could be passing through
Yeah.
that blockage, if any at all. And so then you see a mental health provider and they give you
Right.
antidepressant to increase the
Right.
serotonin levels. But the problem is that it's still, now you're producing so much, but it's still being kind
Mm-hmm.
of blocked. And every now and then, say that block is somehow removed, right? You change your diet, you exercise, some of that
Right.
block is removed. Well, now you're flooded
Yeah.
with
Right.
serotonin,
That's
and
a
that
great point.
also increases
Yep.
anxiety and depression.
Right. And an imbalance in either direction, right? Yeah.
Mm-hmm.
So, right. So if you end up going to see a professional, they end up putting you on an SSRI, for instance, right? How is that impacting folks, right? Because that's selective serotonin reuptake inhibitor, right? So that's trying to increase or keep in circulation serotonin. I mean, I think right there, that's sort of underscores how important this
Absolutely.
hormone is to overall mental health, right?
Absolutely. And when you have these blockages, the other thing is that you could potentially um, be experiencing, an increase of serotonin throughout the day and a
Yeah.
decrease, right? And so when this medication is introduced and there's a blockage, well, now again, at times you're going to have massive increases, but you can also have massive decreases. Well, you're going to be very irritable. You're going to be cranky. You're not going to want to have
Right.
sex,
Right.
and the other problem is it could create addictions too. A lot of people don't realize that most of your addicts and stuff, it's been researched that they have dopamine imbalances and serotonin
That's huge.
imbalances. And when they're, it's hitting that, brain reward
Yeah.
system, and that's leading to increased, uh, gambling addictions, alcohol, food cravings, things
Right.
like that, and now you're putting yourself in a cycle.
Right. So we're talking about folks that can have food addictions and people who are quote unquote adrenaline junkies. Are these the guys down in Wall Street that love being in the pit and big time traders, day traders, and stuff like that? That's them, right?
Oh yeah.
Yeah.
Oh yeah, absolutely. Increase of
Hmm.
testosterone creates aggression, right? In men and
Interesting.
women. So having these balances is so important to our everyday lives. It also, think about it this way,
Yep.
emotional eating, right? So you want to go to the gym and you're all for it. And you get ready and then you start having like intrusive thought and
Yep.
insecurity. You start feeling bad
Yeah.
about yourself. What's the first thing that you go to?
Food.
Oh,
Yeah.
yeah. So
Right.
now you're sitting there eating ice
Yes.
cream, all
Yeah.
upset, and now you're self-hating
A pint
even
of Haagen
more
Dazs
because
or
you
Ben
didn't
and
go to the
Jerry's.
gym.
Yep. Yeah.
Absolutely. And then later on, when you're trying to go to sleep, you're going to experience that
Yep.
sugar crash, and that anxiety is going to ramp up, and now you have trouble
Yeah.
sleeping.
Yeah, exactly. I think this is the other thing that people don't necessarily recognize is that serotonin is a precursor for melatonin, and melatonin helps you go to sleep, right? So they're definitely going to have an issue with that if they have depleted serotonin levels.
Yeah, and so it's like you can create this endless cycle, which is then why in the morning, when you're supposed to be trying to get up, you're falling asleep because you're having another sugar
Yeah,
crash. So you have to force yourself to get up. So what's the first thing that you grab?
something sweet. Yeah.
something sweet or a
Right.
coffee, a
Coffee.
sweet
Right.
coffee,
Yeah.
right?
To boost the energy levels. Yeah. Right. Exactly.
Then you're going to have another crash around lunch. You're going to be very irritable. Sometimes people even get a little sweaty,
Yeah.
to be honest.
Well, that makes sense. So,
And
so a
well,
lot
then
of the
they,
folks that you see, okay, so explain some of you've got 20 years of experience in the field, so you've probably seen quite a few of these individuals. What do they look like? What are some of the symptoms that they have?
a lot of the times, this is where fibromyalgia and pain come
Right.
in because the body is always trying to create a sense of balance and harmony. And, when you're going to like freeze states of the nervous
Yeah.
system due to like complex trauma and things like that, it creates the imbalance. And when your body's trying to find that balance again, this is where a lot of the pain comes in.
All right, that makes sense.
And it's your body's way of alerting you to, hey, this is what's going on. And people know that there's something wrong and something going on, but they don't know what to do about it because a lot of the times they go see their provider, their doctor, and their doctor says, oh, well, you just need to eat healthier and lose weight. Okay, like I haven't
Yeah,
tried
right.
that. Thank you
That
so
never occurred to
much.
me. Thanks. That's so
Right,
easy.
not, hey, you might have a thyroid
Yeah.
issue, you might have a hormone imbalance, right? All of these uh, women at birth, that have endometriosis,
Yes. 1 in 10 women.
cysts on their
Yeah.
ovaries,
Very painful. Yeah.
hormone imbalances, but they prescribe, oh, here's some birth control. Okay, but if you don't know where your hormones are at, guess what? They could give you a birth control that has way too much
Right.
estrogen in it. And now your mental health is affected and your hormones are all over the place. And so your anxiety, depression, meltdowns, anger outbursts, all of those are all over the
Yeah, no,
place.
absolutely, that makes perfect sense. Yeah, I mean, if your estrogen levels are already high and you haven't tested for them, and then and the doctor prescribes something that increases them even more, so you're going to be completely out of balance, and everything's going to be exacerbated.
Or they send you to like a dietitian, right?
Right.
And you get something like phentermine or Ozempic,
Right.
right? Okay, so they're boosting that up, but then you're finding, well, why am I still not losing weight? I'm working out every day, I'm eating
Yeah.
healthy. Well, guess what that's going to do to your self esteem, your
Yep.
self worth, your self
Right.
image? And now you're a depressed
Right.
mess.
Yeah. Now we're dealing with additional levels of depression, of course. All right, so now
Mhm.
we've sort of jumped into diets, and I know we were gonna cover ketogenic diets, the carnivore diet. Do you want to give us sort of a base case for what's the sort of the ideal diet, or what do you see that works? Or
There's not really an ideal diet. It's really figuring out what is best for you and
yeah,
your body because we do need carbs. However, people that have gluten intolerances, I am one of those
oh sure,
people. Um, it could be stored again in the gut because we're not able to break a lot of that down. But even certain vegetables like broccoli and stuff like that can be very hard for people to break
yeah,
down as well. So it's really just about taking 2 minutes out of your day if you can to listen to your body and to kind of figure out what you're needing. Working with your provider
yeah. Have you
is
seen
important on that. There's some genetic
have you
testing.
seen certain diets work in certain circumstances and maybe not so much in others? I totally understand. I think everyone's physiology is like a fingerprint and
Yeah.
they have to go by that. But are there any?
Yeah, intermittent fasting is
Yeah,
really good for people that have, insulin resistance and things like that. Keto's uh, great for that as well because it limits the amount of, carbs and sugars because your breads and pastas and stuff break down as
yeah,
sugar as well. And so that's really helpful, but it's really just about a balance. So somebody like me, I'll have a hamburger, but I might not have the
yep,
bun, but I'll eat the fries
right.
with it, so I'm having more of that
Yep.
balance.
No, that makes perfect sense. Yeah, and we've certainly had our fair share of individuals calling in when they have gut issues. Typically, there are certain vegetables like nightshades that should for the most part, not cause a lot of people a lot of issues, but when they have, you know, compromised gut lining, it is definitely a trigger for them.
Mhm.
I don't know if you've experienced that too.
Yeah, and absolutely, it's really difficult. Somebody like me that has insulin
Mm,
resistance, right? So you think eating an apple is healthy, and
yeah.
it is, but it had one apple has the amount of your carbs for
Right.
the
Right. Right.
day,
Right. Yeah.
right? It increases glucose. Usually, they say that you can have an apple instead of a cup of coffee, and the amount of sugar will wake you up the
Yeah.
same. Carrots. You're trying to be healthy eating
Yeah.
vegetables over here, and carrots are breaking down as
Yeah.
sugar. It's so much to try to process. So you really just have to listen to your body and notice some of those crashes. Protein offsets a lot of sugar. So if you're getting a little sweaty
Yeah.
and you're feeling some of those sugar imbalances, eating some more protein will help
Yes.
with that.
Right. Protein and fat stabilize the energy levels. I always say that. I agree with you. Yeah. And I
Avocados.
think it is somewhat shocking when
Hmm.
people find out how much sugar is in like a carrot or corn. There's a lot of sugar in there and it starts to
Yes.
break down.
And corn, talking
Yeah.
about gut health, our bodies and our intestinal linings do not break down corn
Right.
very
Yeah.
well.
Yeah, there's a lot of cellulose in there. That's that is a that's a big one. I think the other one is it's like 95% of the corn out there is genetically modified. And so it's carrying glyphosate at the very
Yes.
least, and it's, you know, the genetic modification is having an impact on the microbiome, right? So right back to gut health. Like how is that impacting people's mental health? It's not good.
100%. And I've met people from a lot of different countries, and they do
Mm-hmm.
cleanses, because getting some of this stuff to flow again and flow through that digestive system is so important, especially for your circulation in your body
Yeah.
as well, which is what causes a lot of like
Yep.
neuropathy, and things like that. So they do cleanses because it eliminates a lot of like parasites and things that we
Yeah.
pick up from fast food restaurants and things like that. And I'm surprised that here in America they don't do that as
Yes.
often. So over there they do a cleanse about once every six
Yeah,
months
yeah. So your experience has been, I was just going to ask you, okay, okay, so what kinds of cleanses do they do? Is it just parasitic cleanses or and yeah, also the duration?
No, no. So for me personally, I have Epstein
Hmm.
Barr, and I was experiencing a lot of irritable bowels syndrome and things like that, a lot of digestion issues because of
Yep.
complex trauma. And so I found out that I had
Hmm.
leaky gut, and I needed to repair that. And leaky gut goes into, basically all of our internal organs, your
Yeah.
liver, small intestine, large intestine, things like that. And so that's how I came across you all and found your products, because I was so sick. I was canceling with
Yeah.
clients. I was almost bedridden. I was exhausted. I had extreme fatigue. I couldn't figure out what was happening. My stomach felt like I had literal rocks, like trying to pass
Right.
through. It was so painful. And the doctors just kept telling me to diet and exercise. And I'm like, but
Right.
I
Yeah.
am.
Not helpful.
So I came across those products. Yeah. And I did the autoimmune system that you all have with the leaky gut repair as well. And let me tell you, within 2 days, I was out of that bed.
Oh, that's
It
great.
did not hurt at all. I've tried another cleanse in the past a couple years ago for just
Hmm.
parasites, and I couldn't do it more than 2 days because I was stuck in the
Yeah.
bathroom. I was in so much pain. It hurt me more than what I was already
Right.
experiencing. Um, and so with the products that I use from you all, I didn't have that issue at all. Most of it I could take at night right before I went to bed.
Yeah. No, I
It cleared out my
and
system,
I guess
the
I
brain
guess at this point
fog.
I should probably let the viewers know this is so full disclosure, obviously Amanda is, you know, not only an expert, but she has been taking some of our products, you know, our line of gut and liver products from Liver Medic. So I'm glad that it's helping you, and it makes perfect sense because this is sort of this is right up our alley. This is what we do. Um,
Well, this is how I became one of the expert. Well, I'm not a doctor, of course, but in the field and started researching
yeah.
this more. And so I researched for years and years and years before I ever came across your
Hmm.
your products, and that I compared all of a lot of the other products out there, like on Amazon and stuff, of like, okay, what's in these parasite cleanses?
Yeah.
What's in these leaky gut cleanses? Because I want to know what I'm putting into
Yeah.
my body,
Absolutely. Yeah, and we're a physician brand.
and the ingredients are all
Yeah, we're a
natural.
physician brand, and we try to keep things as clean as possible because, of course, we're this is the process that we're detoxing as much as we are trying to repair things. And also, we try to keep things separate because a lot of when we're talking about detoxing and repairing the digestive tract, things have to go in a specific sequence. And I have a pharmaceutical background,
Mhm.
so I'm able to take a look at ingredients and knowing what are fairly common pharmaceutical drugs that people are on. I can try to sort of navigate contraindications. So that's probably what one of the reasons why these things are.
Well, well, one of the reasons why I chose you all too, not just because of the natural products and the products that you had specifically. I know through research helps
Hmm.
those areas to clear those areas and cleanse them, but you also have mental health properties
Yeah.
in there. So
Yes.
ashwagandha that's in there is actually the absolute best thing for
Yeah.
mental health, and it's the best thing for managing
Yes.
cortisol levels.
Exactly. Yeah.
So it's helping not only your physical health and your physical body, but it's helping that mental health and making you feel a lot better, helping manage those cortisol levels that are creating some of these things
Yeah.
as
Well, we
well.
love the educated consumer. Yeah, and when it comes to cortisol levels, right, it's basically it's inflammation and stress. So if we're addressing
Mhm.
inflammation with quercetin, which is really excellent at trying to do that, we have that in the products. If we're not doing anything about the stress component, it's not 100% efficacious. So that's why we threw in the ashwagandha, and of course you would catch that. That makes perfect sense.
So, yeah, so the health problems associated with chronic stress, which is cortisols are
Yeah.
high and immunity is suppressed, include
Yeah.
high blood pressure, blood sugar imbalances, food
Yeah.
cravings,
Yep.
addictions, sluggish digestion, and a suppressed immunity. However, when the cortisol levels are low and immunity is unchecked, it includes digestive disturbances, sleep disturbances, and autoimmune
Yeah,
disorders.
bingo. Yeah, and we see a ton of autoimmune stuff, which it also includes. There might be some listeners with this sort of leaky gut induced Hashimoto's, which I'm sure you probably come across fair amount as
Mhm.
well in your practice. So
Absolutely. And that affects even their therapy appointments because they're too fatigued and
yeah,
exhausted to open their eyes to get the extra help. And they're like, I don't have time to think about anything. I'm in this
right.
brain fog. I can't do anything. I can't physically move. So anything that a therapist is suggesting isn't necessarily going to
Yeah,
work. And then they're just going to feel crappier about
yeah.
themselves because they can't do what people are
Yeah, right.
suggesting.
And that's boy, this is there's so much stuff going on here.
Breaking.
Yeah, that's an added symptom. It's not just brain fog, it's the mood regulation, it's the lack of sleep, it's the high stress. It's you had mentioned earlier about you know insulin resistance, and that's like one of the number
Mhm.
one drivers for health issues like comorbidities. Is yeah,
Absolutely.
so all those dominoes end up
I mean,
falling.
and yes, I mean, I was told that I wasn't going to be able to have children
Wow.
pretty much my whole life. And that turned out after I started kind of working on some
Yeah.
of these things. I have my daughter now.
Oh, phenomenal.
But after I had her, I mean, I went from 110 pounds to 210 pounds when I was carrying
Wow.
her, and I never lost a lot of that weight
Yeah.
after that. because of the hormone dysregulation and because of all the issues we're talking about, which took a huge toll on my self esteem and my
Yep.
self worth, which led me to have anxiety, depression, and get into really negative
Yeah.
relationships.
Okay. So I almost guarantee there are viewers at this point, they're watching this and saying, okay, that's me. 110 to 210, couldn't get the weight off post pregnancy. Okay. So now they're thinking, how did you do it?
So how I did it was, of course, I went to therapy. I got mental health
Yeah.
help. I had to fight doctors and say I think I have a hormone issue. I had a doctor that told me I needed emergency gallbladder
Oh, wow.
removal, and there was nothing wrong with my hormones, which was
Wow.
not the case at
That's a
all.
misdiagnosis.
So I went
Hmm.
Yes. So I went and got my hormones
Hmm.
tested. I got on testosterone,
Yeah.
progesterone. And then from there is where I did more research to the
Yeah.
gut health. And that's where, I found your all's
Well, which
products. I
hormone
took
was out of
that.
whack? Which one
Um,
was high? Which one was low? Give people an idea.
so I only made
Ah, okay.
estrogen.
So you had unusually
That
high
was
levels of
it. And
estrogen?
those,
Okay.
yes. And with that, a lot of diseases
Yeah.
come with that. A lot of autoimmune diseases and honestly, cancers and things like that can come from
Yeah.
that. And so I had to I got the testosterone, the progesterone for that. And then I found y'all stuff, and now you can even see on my medical tests that all of my levels are and my enzymes and all of my ACLs and all of these other things and my metabolic panels are now
Right.
even and under
Right.
control. But from 2009 when I started this process to now, it took that long of getting the help that I actually needed and providers to listen to me
Yeah.
to do that. And I just want to save others those
That's awesome.
experiences. It's even more detrimental to your self esteem when you're seeing a doctor and they're basically fat
Yeah.
shaming
Right.
you
Yeah.
when you're doing all of the
Yeah.
right
Yeah.
things.
Yeah, we hear a lot of people that call in and they say, "Wow, I spoke to the doctor and he said I need to go find a therapist or a psychiatrist rather than, so." And there's obviously there is that mental component, right? So, yeah, you can take certain things, you can change your diet, trying to get these hormones in the proper level is super important. It's not just the sex hormones; it's the cortisol, it's the serotonin,
Mhm.
getting the microbiome back in check. And as you said before, that's going to help with the blood panels when you're taking a look at A1C
And
levels
that
and liver enzymes and all that stuff. But it's
and
not
that's
a,
what we needed to
yeah, it's not a
incorporate.
magic pill. You do need, and oftentimes
Mhm.
it's very helpful to have a counselor who can get you through the mental health aspects of this.
Mhm. Yeah, so I went down 6 pant
Wow.
sizes. I did not lose a single pound at that time. Like I'm still sitting at like 147 right now. But for me, that's
Yep, I
pretty
was going to say
healthy.
that's a healthy
Um,
147.
yeah, but I lost 6 pant
Wow.
sizes from dealing with the mental health aspect of things, getting my hormones situated, and now with clearing out all of the digestive stuff that was in my gut.
Phenomenal. Phenomenal. All right. Is there anything else we have not covered? We want to just make sure that we don't leave any stone unturned.
Well, I think with some of this too, a lot of people, get prescribed ADHD
Yeah.
medicine and things like that for the brain
Yes.
fog. And a lot of times it's more so of not being able to concentrate and focus because of the lack of serotonin levels and just the anxiety and depression that's constantly having them second guess themselves. And it's coming from a lot of these toxins in the body. They say number one, even this is why it's important to floss,
Yeah.
right? Because if you don't, and all of that bacteria gets in your teeth, then it gets
Yeah,
into your
absolutely.
bloodstream. And that is what we're talking about today. And that is why this is so, so very
Yeah, no,
important.
it's yeah, that's true. Maybe we should have a dentist on next. Yeah, dental health is really important. It's all connected, right? You're looking at the mental health
Absolutely.
aspects of it. I'm sort of looking at the liver and digestive aspects of it. But yeah, for complete overall health, there's a lot of check boxes that are sitting there, but they're all doable. They're all doable. That's really key.
Hmm.
Very good. Listen, it's been
Absolutely.
awesome talking to you. You've definitely hit a lot of topics that I hadn't really considered when it comes down to mental health. How can people connect with you, reach out with you? How's that possible? We might want to leave some of that information for folks.
Yeah, they can call the clinic at any time, 870-206-8212, or they can email admin@mindaligncounseling.net. And I can help fast track a lot of, you know, the emotions overriding some of those subconscious beliefs with a lot of the modalities that I do. So that way people don't feel stuck. They're like, I've been in therapy for three
Yeah,
years and I don't really feel like a lot is
yeah.
changing. This is what helps with some of
Yeah, and
that.
I can tell you just from experience when people call in, this is a very common refrain for folks. They don't feel like they're getting supported and they don't feel like the conventional medical community really understands their problem. So it's nice to have somebody like yourself who's gone through it firsthand and has the background to address these things and has gone through the protocols. That's super important.
Yeah, I mean, we didn't even hit on like the toxins and the pesticides that are on our food that stay in the digestive tract,
Absolutely.
or, how they've linked a lot of this stuff to things like autism,
Yes.
ADHD, uh, not being able to absorb the nutrients, from the foods or
Yes.
from the medication that people are taking for their metabolic rates and things like that. There's so much that we can go into, but it really does affect every single level and component of one's life, from their job to their relationships, to their just levels of happiness as people
Yeah,
in
absolutely.
general.
And you've hit on a number of categories that we talk about on a regular basis. We're going to have you back, Amanda. But yeah, just the one that you just mentioned there just triggers me because physicians in particular, they go ahead and they'll prescribe the same things over and over again. And a lot of these drugs, almost all of them, block something, some nutritional aspect, vitamin or mineral or
Mm-hmm.
something. And they typically don't know what it
And
is,
you've
and
got it.
they don't tell the patients. So they take these things for years and years, and then they're chronically deprived of these critical nutrients, and they're not even aware of it. So that's a great point.
And think about if they're doing that and they're pregnant, babies getting or not
Right,
getting what they do, what they have. And that's where you have, therapists talking about in utero and the early stages of 0 to 5 with the nervous
right.
system really developing and things like that. How can that happen? And how can that happen in the best way possible if they're not getting the things that they
All right, this
need?
is a topic for another podcast, no doubt about it. I think we have to address that. Amanda, it was awesome having you on. Really fantastic. Very good guest and some great background. And for the viewers out there, if you like the content, like and subscribe, and we'll catch you on the next one.